Hello and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association, and today we're taking a deep dive into the first 90 days following a heart attack because it's such an important time to address critical issues such as doctor visits, rehabilitation and recovery, and reevaluating daily habits. But first, in today's headlines, when the Buffalo Bills' Damar Hamlin experienced a sudden cardiac arrest on Monday Night Football, the difference between heart attack and cardiac arrest became top of mind for the entire nation. But did you know that they are not the same thing? Sudden cardiac arrest is when the heart malfunctions and suddenly stops beating, which is called arrhythmia or an electrical problem. A heart attack is when blood flow to the heart is blocked, or what we call a circulation problem. Cardiac arrest remains a public health crisis. In fact, there are more than 356,000 out-of-hospital cardiac arrests annually in the United States, and nearly 90% of them are fatal. That is, people die. Thankfully, Damar Hamlin survived. His trauma certainly highlights the value of immediate CPR intervention. We at the American Heart Association recommend that someone from every household learn CPR and be able to save lives. For more information, check out www.cpr.heart.org. After a heart attack, the first 90 days are a period of high risk, and patients are understandably filled with anxiety about their long-term health. First, let's take a closer look at heart attack. What exactly is happening to prevent blood flow? Blockages are usually caused by blood clots in an artery that normally supplies oxygen and nutrients to the heart. Several factors can cause blood clots to form, such as atherosclerosis, which is the buildup of cholesterol plaque, fat, calcium, and other substances that accumulate over time. Smoking, diabetes, obesity, and high blood pressure can also contribute to the formation of blood clots. And sometimes a heart attack can also be caused by spasm of the coronary artery, in which it narrows and reduces blood flow. This is most common with people who have a history of coronary artery disease. If you suspect that you or someone is having a heart attack, call emergency services immediately. Prompt treatment is essential to limiting the damage to the heart muscle, and emergency services can provide life-saving treatment such as oxygen therapy, medications, and defibrillation sooner than waiting until you get all the way to the hospital. That said, it's also important to stay calm, sit down and rest, and take any prescribed medications for chest pain. At the hospital, doctors will determine the best course of treatment, possibly blood thinners, stents, angioplasty, or in severe cases, surgery. After the immediate crisis has passed, the first 90 days following a heart attack are considered a high-risk period because the likelihood of having another heart attack or other cardiovascular event, such as a stroke or cardiac arrest, increases for many reasons. The damaged heart muscle needs time to heal. The risk of complications, that is, the chance of complications, is higher, and the underlying conditions that lead or led to the heart attack may still be present. Additionally, patients may experience anxiety or fear or depression, and all that can get in the way of taking medications as prescribed or making lifestyle changes. The road to recovery is a complex journey, and there's no one-size-fits-all approach. But there are some steps that people can take to improve their chances of survival and minimize damage to the heart. For the first 90 days, patients should be closely monitored and attend regular follow-up appointments with their doctor or doctors. These visits include testing and treatment plans. During this period, patients should also look at their lifestyle, how they eat, are they smoking, are they physically active, and make the positive changes to improve on the risk factors that can lead to cardiovascular disease. First thing to do, as I already said, stop smoking and start eating healthier foods so you can maintain a proper weight, help your heart health, and prevent future heart problems. Next, you may be wondering when patients can start to exercise, go back to work, drive, drink alcohol, have sex, etc. Many of these questions are answered during cardiac rehabilitation, which can begin 1 to 2 weeks after a heart attack. Rehabilitation, is a structured approach to exercise under the guidance of professionals tailored for the individual's needs. Walking and other light exercise is generally encouraged very soon after a heart attack, but the timing and intensity may vary. The same goes for driving, but only if the patient hasn't had a procedure. Patients who've had a procedure such as angioplasty or a bypass may have to wait 4 to 6 weeks or more to drive. Patients should generally wait a couple of weeks before returning to work and definitely avoid heavy lifting or strenuous labor. Alcohol consumption is best to avoid because it can negatively affect your heart and interact with medications. As for resuming sex, patients really should listen to their body and not push themselves too hard. In general, patients should resume daily activities slowly and generally increase activity levels over time. Additionally, heart attack patients may experience mental health concerns, including anxiety, depression, and post-traumatic stress disorder, that is PTSD. Anxiety in particular can cause physical symptoms, such as chest pain, your heart racing, that mimics heart attack symptoms. Depression may cause changes in appetite or sleep and get in the way of doing those healthy things, taking your medicine, not smoking, being physically active. While PTSD symptoms may include flashbacks, intrusive thoughts, or hyperarousal. It's just as important for heart attack patients to seek help for mental health issues as it is to get help for physical issues. Treatment can improve quality of life and reduce the risk of future heart problems. To sum up, the first 90 days following a heart attack are a high-risk period for patients. After the crisis has passed, the immediate focus should be on preventing additional heart attacks or other events with medical intervention, lifestyle changes for the positive, and cardiac rehabilitation. Eventually, patients will transition to a long-term view of recovery and a long-term view of life and a return to a new and better normal. If you have questions about health conditions, I would love to hear from you. Comment below, hit subscribe, and join me here next time for Answers You Can Trust.